Good morning. Welcome, everyone. Thanks for joining me. Early and decisive actions, along with Manitobans' hard work and dedication, have made a big difference in our fight here against COVID-19. And I want to thank Team Manitoba for all the great work. Our strength as people in this province, our empathy, our courage, our resilience. I can't say thank you enough. Manitobans have understood and stuck to the fundamentals, and I thank everyone for their calm in a challenging and difficult time, I know, for many. Their kindness, and thank you for keeping safe and helping others keep safe. There's no room, though, for complacency. We're in a pivotal time in this battle against COVID. And so I want to say that we must make sure that we continue with these fundamentals. What got us here is pivotal to keeping us going. We don't want a COVID comeback in Manitoba. Our number one priority during this unprecedented global pandemic has been keeping you and your loved ones safe and ensuring that we have a healthy Manitoba today, but managing so we have a healthier Manitoba tomorrow too. Notre priorité numéro une au cours de cette pandémie mondiale sans précédent a été de vous protéger, vous et vos proches, et d'assurer la santé de Manitoba aujourd'hui et pour l'avenir aussi. On April 29th, our government unveiled Restoring Safe Services Together, Manitoba's Pandemic Economic Recovery Roadmap. It is a Manitoba plan. It is made for Manitobans, by Manitobans, to move forward with confidence, to slowly and carefully restart our economy and reopen our communities. Il s'agit d'un plan de Manitoba conçu pour les Manitobains, pour aller de l'avant en toute confiance, pour redémarrer lentement et soigneusement notre économie et rouvrir nos collectivités. The plan is evidence-based. It lays out the groundwork to ease public health measures. We've been able to create widespread public awareness, and Manitobans continue to respond by practicing the fundamentals and adopting physical distancing behaviors. A critical element of our flattening efforts and contributing to Manitoba's continued success is our high levels of testing, of tracking, and of isolation when necessary. And as a result of our collective efforts, Phase 1 was launched on May 4th with the reopening of some non-essential healthcare and retail businesses under strict guidelines. With input from tens of thousands of Manitobans via surveys, via telephone town halls, via online submissions, we were able to move forward with Phase 2 on May the 27th, just a few short days ago. Now, thanks to the efforts of all Manitobans and the public health measures in place, we have successfully kept our COVID curve flat. Our province has some of the lowest positive test rates in Canada, and that's a good thing, not just in Canada, but throughout North America, in fact. And there's a lot to take into consideration as we continue to make efforts to restore our services safely. Key criteria have been met since the implementation of Phase 1 and Phase 2 that allow us now to consider further easing of public health measures. Today, I am pleased to share with Manitobans the draft plan for Phase 3 of Restoring Safe Services Together. We hope to be in a position to move forward and ease more restrictions on June the 21st, but, and I emphasize this, that'll be up to Manitobans. And it'll of course be up to what we see and hear over the coming days in respect of how COVID is doing and how we're doing to keep that curve flat. Aujourd'hui, j'ai le plaisir de partager avec les Manitobains et les Manitobaines l'ébauche du plan de la Phase 3, de rétablir ensemble des services sécuritaires. Nous espérons être en mesure d'assouplir les restrictions de 21 juin, mais ce sera au Manitoba et ce que nous verrons et entendrons au cours des prochains jours. The draft plan for Phase 3 builds on the measures and guidelines implemented through Phase 1 and 2. Once again, we'll be asking Manitobans for their input as we carefully move forward in our recovery efforts. And I encourage all Manitobans to look at the plan, read through it, go to Engage MB, and give us your feedback. Phase 2 acted on many of the suggestions that you made and was modified and I think improved as a result of your input. So I would sincerely encourage you to give us your ideas, thoughts, and comments. Engage MB will continue to be an important resource for Manitobans, especially for small businesses with questions on restoring their services safely. Some of the measures that are being examined for Phase 3 include increasing gathering sizes to up to 50 people indoors and 100 people outdoors, increasing capacity and developing guidelines for faith-based and other cultural gatherings, easing border restrictions to allow residents of Western Canada and Northwest Ontario to enter Manitoba without the need to self-isolate for 14 days, resuming regular licensed capacity for childcare centers, increasing capacity for day camps from 24 children to 50, increasing indoor occupancy levels for community and service centers and senior centers and clubs, working with industry such as film production and professional sports on a case-by-case basis to allow for employees to enter Manitoba without self-isolating for 14 days. Increasing indoor and patio occupancy limits for restaurants, bars, beverage rooms, brew pubs, microbreweries, and distilleries. Removing occupancy limits for retail businesses while ensuring members of the public are reasonably separated, and lifting occupancy limits for regulated and non-regulated health professions, including registered massage therapists. Now, while we can take pride in the progress we've made and the additional steps that we're considering today, we must remain vigilant. And I want to stress, if public health results begin to deteriorate and our guidelines are not sufficient, Phase 3 measures may be paused, and in fact, previous measures may be reintroduced. Je tiens à souligner, si les résultats de santé publique se détériorent où les lignes directrices ne sont pas suffisantes, les mesures de la phase 3 peuvent être suspendues et les mesures précédentes peuvent être réintroduites. We will continue to review the data. We will rely on the advice of our healthcare experts to determine our next steps. We will continue to monitor the trends and the conditions, not just here in Manitoba, but in other jurisdictions as well, as we continue to reopen our businesses and our borders. We'll be successful if we keep working together as a team. Remember, as we make this recovery happen, you are the reason, and the reason we can continue to move towards recovery will be you in the future as well. Your security and protection is our motivation in every decision we have taken, and not every Canadian is given the opportunity to save a life. But you do have that opportunity, and you have saved lives, and we will save even more. Thank you very much. I look forward to taking your questions.
Thank you, Mr. Premier. A reminder to our reporters online, you will have one preliminary question and one follow-up question. Up first this morning from City News, Jonas.
Good morning, Mr. Premier. Jonas Gilbart, City News. A couple of things that aren't named on this list that I think folks may be looking at in Phase 3, or we're expecting perhaps maybe casinos or movie theaters. Any thoughts on those?
Yeah, the opening of casinos and movie theaters is on the horizon, we hope. It'll all depend on the results of Phase 2 over the next few days. We're welcome to input, but those are not included, as you noted, in the proposed plan.
I guess moving forward onto the reasons for that. I mean, we've seen Alberta move forward with their Phase 3. Their numbers are higher than ours. I think we're going to see a lot of people wondering what's the difference here in Manitoba and why we aren't proceeding on those.
Well, Alberta will make decisions for Alberta, and we'll make decisions here based on consultation with Manitobans. So any Manitoban who has a desire to participate in that process is welcome to. We had thousands of Manitobans participate in planning Phase 2. So I don't want to prejudge the outcome of those consultations. I know there are arguments to be made for, and there are arguments to be made against opening of some, cinemas and the like, and casinos, but I'd invite Manitobans to give us their input on this. We're trying to move safely forward. We don't want to have to move backward.
From the Winnipeg Free Press, Carol.
Good morning, Premier. It's Carol at the Free Press. I was wondering, did feedback from last Friday's Black Lives Matter rally outside the legislature and people concerned that there was this huge gathering for more than 2 hours that seemed to not rattle anybody too much in public health or provincial officials, does that have any impact on today's decision in terms of crowd sizes and what Phase 3 is going to look like?
I think, Carol, to be fair, what we're trying to do here is move ahead safely and gradually. Too fast for some, too slow for others. But I think the important thing to remember is that it's the willingness to adhere to the fundamentals that got us this progress. And so I would just remark that we all need to keep emphasizing that to ourselves and to one another if we want to continue to make progress against COVID.
And Doug Ford in Ontario has said that, he's the first premier in Canada to have a COVID-19 test. Have you been tested?
I have not, and I have not exhibited symptoms as of yet, and I'm very thankful for that, and I am tremendously sympathetic and empathetic to those who have experienced COVID. I understand it is a miserable experience for most people.
From Global, Brittany.
Good morning, Mr. Premier. It's Brittany from Global News. On interprovincial travel, I know it's been a big topic that we've discussed with you over a number of times. When we talk about the Western jurisdictions where we can go when we don't have to isolate, would this include all 3 provinces to the west? And would that possibly be restricted again if we see cases in those provinces start to increase?
Partially, yes to your first, Brittany. That would include Saskatchewan, Alberta, and British Columbia, but also include the territories. And yes, we have to be ready, if need be, to reverse and reimpose some restrictions if COVID begins to make significant comeback. And on that, I would just mention it's not just case numbers. In fact, we probably should get away from looking at case numbers because we expect very likely with increased interaction and increased freedoms, case numbers, and testing, of course, we may get higher case numbers. The real issue, according to Dr. Roussin, is the percentage of positive test results. And as long as and Dr. Roussin can clarify this much better than I, but as long as we keep our percentage of positive test results as a number down below a certain level, that's really the key. So I don't want to unjustifiably try to frighten people into not being, not moving around and enjoying the spring and summer in Manitoba. But I do want to remind people to do so safely, and I think that's really the important thing here.
Thank you. And I'm just looking at the plans for the return to school here when we're talking about that. We've already heard from some other provinces who do plan to return in Saskatchewan and Alberta to school in the fall. Is the plan as of right now to have students return to in-class education?
I think that the discussions around education began the day that the restrictions on school operations began, and there have been modifications all the way along that path. I would say again, thank you to our administrators, our teachers and teachers' assistants, the folks who work in the schools and keep the schools clean and operational for our children. Thanks to them for dealing with this. Our bus drivers, the folks who do the cafeteria work. Everybody has been working so hard to try to adapt. I don't want to prejudge where we're going to be in the fall, Brittany, because I just don't know where the COVID numbers are going to be. Manitobans will play a major role in determining how rapidly we're going to be able to get back to the kind of school operations or other aspects of our society that we're used to. But I would simply say that I think that dialogue and that planning will continue and is an ongoing thing.
From the Brandon Sun, Colin.
Hi, Mr. Premier. Colin Clark with the Brandon Sun here. I see that there will be exemptions for people employed or affiliated by a film production or professional sports team. They won't have to self-isolate for 14 days under this plan. What went into making the decision to exempt people in those industries?
Colin, we'll have to get the detail. I believe they'll still have to self-isolate prior to coming here. But let's get clarification for you on your question. We'll make sure of that. I think there's an understanding that that is a requirement for professional athletes, certainly. I'm not sure about the film industry people. The rationale for this, of course, these are very important aspects of our society in Manitoba. We have the defending Grey Cup champions here. We would like them to do that again a second time. We want to make sure that we do it safely.
Okay. And my second question is, it says that people from other provinces can enter Manitoba without the need to self-isolate. Does that also mean that Manitobans going to those provinces and territories and coming back will also not need to self-isolate?
That is correct, but remember that other provinces have the right to change their rules as well, and so we shouldn't presuppose that may not be the case. Not every province is doing as well as Manitoba in terms of flattening the curve on COVID, and other measures may have to be adopted at some point. In the meantime, though, for business travelers and for leisure travel as well, these provisions will no longer be in place under the draft plan. Manitobans who are concerned about that and think we're going too fast, or those who think we're going too slow, are welcome to comment. And I'd encourage those who think we're doing really well to also comment. I wouldn't, it wouldn't hurt my feelings if we got the occasional supportive comment. But the fact of the matter is these suggestions are important to help us make sure that we're doing the right things that suit the needs of Manitoba specifically.
From CJOB, Diana.
Good morning, Mr. Premier. Diana from 680 CJOB here. With respect to those travel restrictions on self-isolation being relaxed for Western Canada, Atlantic Canada has kind of relatively similar epidemiology to Manitoba. They don't seem to have super high cases. Why are these rules not being relaxed for domestic travelers coming from, say, Nova Scotia?
That's a great question, and that's where we're looking for input. We are proposing that we start with those who are, that you can travel to by car, obviously, if you wish, and that's where we expect the majority of travel might happen. Others may suggest that we should allow flights in from the Maritimes. Right now, I don't know how possible that is, quite frankly, but those are suggestions that we'll welcome, and we'll have a look at them.
Okay, thank you. And then just as a follow-up, what would kind of constitute an acceptable level of cases, obviously assuming all goes to plan with BC, Alberta, and Saskatchewan, and they don't see any major spikes, this will happen where we don't require those domestic travelers to self-isolate. What kind of spike in those provinces would kind of change that and say maybe, okay, Alberta's been a big issue, we're going to require people coming from Alberta to self-isolate again?
Yeah, you're on to, I think, an important issue here, Diana, and this is one I'd like you to address this to Dr. Roussin, but I will say this. It would be my hope that at some point next week that I would be able to share with Manitobans what would be the necessary prerequisites that would get us into, say, an amber zone away from a green, or get us into a red zone where we would have, what measures might we have to take so Manitobans can better understand the consequences if numbers get to a certain level on, for example, positive test results. When does that get us to an amber, and when does that get us into a danger zone? I think it's important for Manitobans to understand that, and I think it's important for us to be prepared to accept whatever measures are necessary to keep each other safe. Hopefully, going forward, we do the right things and continue to protect one another, but we should also know what the consequences are if we begin to lose the battle on flattening the COVID curve, too.
From the Winnipeg Sun, Scott.
Hello, Premier Scott Billick, Winnipeg Sun. This question sort of follows that one, but I guess we've seen resurgence in other cities as they have been reopening, a resurgence of the virus, of course. I guess what makes now the time to continue ours when we've seen other places, spiking in cases and stuff like that as they've kind of loosened the restrictions more broadly, I suppose?
Well, I think, Scott, it's the time to do it because Manitobans deserve to be rewarded for, in the vast, vast majority, doing the right things to help us win this battle. And I think also that what I'm clearly doing with these comments today is planting the seed, which should not be a seed of doubt in anyone's mind that we'll have to go back. I hope we don't have to go back. I hope if Manitobans continue to do the right things that we're going to be making more progress. But I think it's important for us all to accept the shared responsibility we have, the credit thus far, and frankly, the credit going forward will either belong to us or the blame will belong to us. It's entirely up to our choices. So I'll keep emphasizing that at every opportunity, and I know Dr. Roussin probably will as well.
Sure. Follow-up question. Hair salons were included in first phase, I believe, but their restrictions aren't being lifted the same way that maybe like restaurants or other businesses are in the third phase. Why is that?
Well, the restrictions were lifted in phase 2 to allow broader service offerings. But I think Dr. Roussin would be probably better to give you the science on the decision making here. There is close contact involved in offering those services for a somewhat prolonged period of time. Maybe less with some fellows and more with others, depending on the amount of hair work that has to be done. But the fact remains that you do have a close contact, and that does increase risk. So I think that might be what Dr. Roussin will say, but I encourage you to ask him. He'll be available to you in a not very long time.
From CBC Radio Canada, Mohammed.
Hello, Mr. Premier. It's Mohammed from CBC Radio Canada. I was just wondering about how about travel to northern Manitoba? Is there any changes about this for phase 3?
Not in the draft plan, Mohammed, but I have heard from Chief Arlen Dumas, Grand Chief Dumas, that there may be some communities that are looking at restrictions of some kind in addition to these. I can only say that those band leaders would be the best ones to answer questions about their plans.
Thank you very much. And I was just wondering that also for the future phases, is there any discussions with other provinces, our border restrictions are eased to have a common guideline for the future?
I didn't get all your question. I'll try to answer what I derived from what I heard, Mohammed. I think there is a real desire, certainly among premiers in Western Canada, to continue to make sure we don't allow the borders between us to interfere too much with our recovery. All the provinces in Western Canada have, as all governments have made diligent efforts to try their best to get the COVID curve flat, and we found significant success here in Western Canada. And we also have long-standing trade connections with one another. So reopening the ability to travel, do business with one another, visit one another, without the restrictions that have been imposed, and I would argue necessarily to protect us, will help, I think, to restore our economic and social well-being. And so there's a price to be paid for closing the borders for too long, and I think many small business people would say they've already been paying that price. There's also a social price in not being able to visit family and friends in neighboring jurisdictions, and we know that too. So we're trying to restore our lives. This is the draft plan, remember, and others may have different ideas on the pace or the nature of what changes they would like to see happen, and I would want to encourage them to express their views on the plan.
From CBC Manitoba, Bart.
Mr. Premier, where do you draw the line in northwestern Ontario? Is it Kenora, Dryden, Thunder Bay, Sudbury? How far east?
We're just talking about that's a great question, Bart, and I think we have to have a specific community or a specific line mentioned so that clearly we can enforce and be meticulous in the enforcement of what we're offering here. I believe it would be somewhere west of Thunder Bay, but the exact point is something Dr. Rusin will probably be able to share with you a little later, if not today, I think tomorrow at the latest. And we will, I think we should add that to the draft plan so people can see that specifically. I don't believe it's in the draft right now.
Did your people, government, staff, consult with the Winnipeg Jets, Blue Bombers, CFL, or NHL on the pro sports provision?
All of the above.
From the Canadian Press, Steve.
Premier Steve Lambert from the Canadian Press. On the pro sports item, a lot of professional athletes are American. They're still required by the federal government to quarantine for 14 days upon arrival. So is this provincial provision just being put in place in the event that the federal quarantine requirement is changed?
Steve, I'm going to have to get detail for you on that question. It's a proposal in a draft plan. We'll have to verify whether in fact it conflicts with in any way with a federal directive. I'll have to get clarification. I'm sorry, I can't give you an answer on that right now.
Okay, my second question is regarding, you mentioned, the plan mentions small summer festivals. Clearly the province is moving towards more outdoor gatherings. A lot of community events that may involve 100, 200, 300 people, charity running events, that sort of thing, have had to be postponed in the spring. They've been things like the Manitoba Marathon, which involves a few thousand, is tentatively booked for the fall. Are you looking at allowing those type of events, which might involve several hundred people?
Yeah, within the parameters, as Dr. Rusin can elaborate on, Steve, there's going to be the opportunity for cohorts of up to 50 people to gather. So for example, we'll give an example of a community event. 50 people can gather as a cohort in one area of a facility, another 50 as well. I believe in the rules it says up to a capacity of approximately 30% of maximum capacity. So that's going to allow some smaller venues and smaller events to happen, and I think that's going to be pretty exciting for a lot of people around the province. Church gatherings would be an example, community gatherings of some kind. I know for families like ours, a chance to get together with family members, and many families will have this situation where they've lost someone, or there's a baptism, or maybe even a wedding. So those are the kinds of things that now we'll look for input for the next few days. I should mention, I'd appreciate it if Manitobans can give us their input by end of day Tuesday, just so we can have a chance to peruse all the suggestions, and then at some point in the not too distant future we'll be able to announce changes or not, depending on what we hear and depending on the COVID cases going forward.
From CTV Winnipeg, Jeff.
Hi, Mr. Premier, Jeff Teal, CTV Winnipeg. I know you've touched on it, but with all our recent cases being from travel, why are you confident that we may be able to open up travel more from other provinces and lift some of these restrictions?
Well, remember, what we're talking about here is not restricting travel any more than it's been restricted in the past. What we're talking about with this draft plan is eliminating the need for social isolation. If you don't demonstrate symptoms, then the need for social isolation isn't there. If you do, then it is. And if you do, the advice I'm sure the doctor would repeat is go and get tested and stay away from other people until you find out you're okay. That's the same actual advice we've been giving all the way along. So the reductions in restrictions are, I think, a natural response potentially to our continued success in keeping our percentage of positive test numbers down, and we hope that we can continue to do that going forward so we can get our normal lives back here as much as is possible given the realities of COVID.
And again, I know you've been asked this, but there's no date to theaters or casinos? Can you give us an idea?
Not really. I think, as I've told you during the Phase 2 announcement, when I was asked about Phase 3, I said we'll get to that after we see how Phase 2 goes, and I'll give you the same answer on this. We'll get the input. We'll make a decision on how we proceed on Phase 3. As Phase 3 moves along, we'll evaluate again and continuously how we're doing, how our neighbors are doing, and then we'll make the appropriate decisions moving forward. I think to jump ahead too fast is probably not helpful in this instance.
From the Carillon, Greg.
Hello, Mr. Premier. Greg Vandermeulen from the Carillon here. You already have gathering sizes for indoor and outdoor groups. I'm just wondering why further guidelines are needed for churches that are the faith-based institutions, and what you think those might look like.
Well, there's protocols that we've worked very hard on. We've actually had a team of government caucus members working diligently with church organizations around the province and around the city of Winnipeg to come up with coherent strategies around how church organizations can operate effectively to protect attendees and their families during services and with other gatherings sometimes involved as well. I would emphasize that the cohort numbers I referred to earlier apply not just to churches, they'll apply to the convention center if they're hosting a sales congress or something like that. The rules are the same, and they are to be followed. And should they be followed effectively, then we can be rewarded as we move forward, as we win the battle against COVID. I would emphasize too, it's no one's asked me, but I will emphasize that although we are in this plan proposing to reopen VLT facilities, we are not going to be proceeding to reopen smoking VLT facilities. We have worked too hard to protect the health and well-being of others to miss the opportunity to work effectively with First Nations, and I have spoken to all the leading chiefs. My caucus colleagues, my ministers, are in direct contact with all affected First Nations leaders so that we can work together to eliminate the risks associated with smoking and secondhand smoke in gaming facilities, not just VLT lounges, but other facilities as well, bingo halls and the like. We really applaud the work of our First Nations leadership in this province. Unlike other provinces, our First Nations leadership has effectively kept COVID case numbers almost non-existent, let's put it that way, and that is tremendous work. And why? To protect the health and well-being of First Nations residents and their families. We need to do the same now, and we inherited these rules which allow smoking. We've got to get rid of them, and this is the time to do it in keeping with our consistent and unifying desire to see people kept healthy and well. Thanks to everyone. Congratulations to Manitobans. Thanks for your input. We'll look forward to receiving it.